Thank you, everybody, for joining us, both the guest and the panelist and the moderator. My name is Dan Tryon, and I run the organization called New England Israel Business Council, or NAIBC for short. Our mission is to strengthen the business relationship between Israel and New England. And the way we achieve that mission, we do three major things. I'll divide it into three buckets. The first bucket is facing the public or public activities. This webinar is a good example for that. The range of the webinars can go all the way from quantum computing to women health. The second bucket is working with individual companies, usually all the way from ideation stage to go-to-market stage, different marketplaces, and so forth. We provide advice. I didn't mention it earlier, but we are a not-for-profit organization, primarily volunteer organization. So we're doing all our work pro bono. So that's the second bucket. The third bucket is we represent Bird Foundation in Massachusetts. And Bird Foundation, or the way I call them, Bird Venture. It's an investment arm that was founded by the American federal government and the Israeli government to fund a mutual project between an Israeli company and an American company. And it happens to be that one of the companies on the panel, XR Health, was one of the winners of such funding when they did a project with Beth Israel Hospital in Boston. And with that, without further ado, I'll introduce Gila Tulu, our moderator for the webinar. Gila, the floor is yours.
Thank you, Dan. Thanks for inviting me. And I'm very happy to see all of you, some new faces, some familiar faces. And for the topic that's the closest to my heart for many years, but especially obviously since October 7th. I'm going to start with just an overall introduction of mental health, trauma healing, and just so that everybody's on the same page about what's going on here, and then give the floor to our CEOs and chief medical officers who are working on bringing this technology to market here in Israel to try to accelerate trauma healing. I have to say most of those organizations were actually fully concentrated on the US market, but they're all doing also amazing efforts to try to see how to bridge what they're doing in the US with what's happening right now in Israel, which is a big investment in time and resources in management focus. So congrats also to everybody for jumping on this and supporting with the current situation. So what I'm going to cover first, I'm going to do quick introductions of what is IKAR. You can see the logo on this page, which is the organization I represent. And then I'm going to do a quick 101. I assume not everybody is as familiar with trauma. Some folks are probably extremely familiar with what trauma is, some folks less. So very quick introduction, so we're using similar words. And then perspective on how tech can support with the recovery, and then we're going to listen from our health tech executives. So quickly about me, I'm Gila Tulu. I was 20 years a consultant, the last 12 with McKinsey. I am French. I was 12 years in the US, and I made Aliyah, and I moved to Israel 8 years ago. And when I moved here, people told me, if you can't do, you teach. If you can't teach, you consult. So I'm very low in the food chain of Israeli society. But I developed some perspectives from my work across the value chain in healthcare. I led McKinsey's work in vaccines from 2015 to 2020. So before it was sexy. And then from 2020, I was focusing on health equity, which was a lot of women's health and mental health. With IKAR was born after the war. I quit McKinsey in July with the famous last words that I'll know what I'll do after the Jewish holidays. And the war came. The first 3 months I spent them helping Nova survivors in Chavad Ronit farm, and then Rishpon. Saw firsthand some of the issues we're having in the country, and decided to build Ikar Collective with the goal of bringing a diverse group of experts from medicine, psychology, public health, philanthropy, investment, and create a sort of collective that will help identify the issues in trauma that the country is facing and help allocate resources disproportionately where they're needed. One of the things I learned from my time in business is the worst thing we could do is peanut butter spread money. The most difficult decisions leaders have to make is how do you allocate where it's really needed? And the truth is we don't know, because trauma has this way of working that it evolves very quickly. It evolves differently based on the situation. And so we want to keep the pulse, and then help allocate those resources. And our goal is to not exist in 8 to 10 years, because every year, 2 years, as we see that interventions are working, we should decrease the reliance on philanthropy and move that to the system, right? To the HMOs, the health plans, or to the government. So we're a nonprofit organization that just wants to help with that transition from being treatment focused to prevention focused. On the team is Professor Eyal Fruchter, who was a former psychiatrist and expert in PTSD at the IDF. Roy Peled, who was a former Israeli military and security, and also has experience from Amutat Duftevan, which is a nonprofit organization, and Michal Sela Forum, and Lisa Silverman, who's bringing 25 years of experience in the world of philanthropy and NGOs, and a lot of experience in the hospital field with at NYU Langone. I'm not going to go through all of this, but just to say that our scientific board, brings people that come all the way from mindfulness, all the way to ketamine and psychedelics. So the idea is that we actually think that a lot of things have to be done along the value chain. And that's what I'm going to discuss today, a little bit about how tech can help all along. So what's trauma? Let's start with just a definition. There's a traumatic event, and then we have acute stress response. This is usually like 72 hours. Then there's acute stress disorder, which is usually defined as something up to 4 weeks. And then it can turn into different psychiatric disorders. A lot of people talk about PTSD because if you have those symptoms that last over time, it could be PTSD, but some people will never develop PTSD. Actually, most people, sometimes the most important thing to say is that most people will not develop PTSD, but you could go into other issues like depression, anxiety. By the way, all this is also turned upside down when this is not a car accident. This is a war that started on October 7th, but it's ongoing and it's been 6 months. And for some people, the traumatic event was October 7th, but for some it was in December, where their son was killed in Gaza. And for some it was last week. And for some of our hostages, obviously it's still happening, and for their families as well. And so this is an ongoing situation, and it's very complicated to say, 72 hours, 4 weeks, 6 months, not really so easy. Now, what's the impact of trauma, and why do we think we need to spend so much time on this, and why are we looking at all technologies, etc.? It's because it goes beyond mental health. Actually, it goes into physical health. You have more likelihood of developing cardiovascular diseases or autoimmune diseases, cancer. The productivity is at risk. Kids are 2.5 times more likely to repeat grades. Parents have harder time keeping their jobs. On-the-job accidents go up. And then from a security point of view, we know that anything that impacts your serotonin levels, impacts your aggressivity levels, impacts your impulsivity levels. And therefore, we have more risks of addictions, more risk of domestic violence, abuse. And that is, and obviously for a country like ours, it's also about making sure that our soldiers can go back to defend the country. And so, trauma healing is way beyond mental health in my mind. The way I wanted to propose a framework for how to think about how technology can help, right? I mean, you can take the girl out of McKinsey, but you don't take McKinsey out of the girl. And so frameworks help me think, So there is primary prevention, secondary prevention. Primary prevention is what you do before there is even an attack, right? I always laugh with people. I say, when you say no to your kids, you're building resilience, right? Something people forgot at some point, right? But so this is primary prevention, building resilience. And then, unfortunately, somebody asked me, can we prevent trauma? And I was like, well, we can have a chat with Hamas about this. But at the end of the day, the trauma will happen. And that's when we start to talk about secondary prevention and early intervention, right? It's what you try to do right away to make sure that it actually doesn't develop into something more serious. But if it does, you need to look at different treatment options, methods, tools, technologies. And then you have what we call tertiary prevention, which is making sure that the person doesn't need to go back into treatment because this is a cyclical situation in mental health. And so, for example, in this little treatment is where we talk about triage, diagnostics, and treatment, right? But it's between secondary and tertiary prevention. Now, there's three levels of support when you think about technology, but when you think about any services and solutions in mental health that I think are important to keep in mind. There are things we can do at a national level, right? There are things like think about a national campaign of psychoeducation, and there are things we can do at the community level, and there are things we can do at the individual level. And that's the second piece I want to think about. And you'll see that in the end, I'm going to bring together those three levels of preventions and those three levels of support to think about technology. But before that, I wanted to talk about three big issues that are important to keep in mind as well, where tech can really play a big role. And these are things that existed way before October 7th, right? And it's important because I hear some people say, oh, I want to only focus on issues that are October 7th, right? But there are a lot of things you can't do without fixing problems we had on October 6th, right? One is that we have a big shortage of professionals. So any technology that can help unburden our mental health professionals will really support the whole nation. By the way, this is true everywhere in the world. I was today on the phone with professors at Harvard who are having the same issues, right? The fact that we have not enough psychiatrists is a global problem. And the stigma is also pretty high. And again, this is not surprising. I mean, we've done a lot of work around mental health and destigmatization. In the US, I think the opioids crisis also helped a lot. COVID helped tremendously with destigmatization and looking for help. But here you can see that in Israel, almost 1 in 3 Jewish Israelis would deny themselves support because they're afraid of what it would mean, right? And so anything that can help, address this. And one thing I want to say about stigma also is looking at HIV and what we learned from HIV is sometimes it's not about, I don't think we really managed to kill stigma in HIV, but what we did is that awareness was so high that people were getting the help they needed. So sometimes it's about raising awareness so much that stigma is less of a problem. And lastly, it's a very complex and fragmented ecosystem in Israel, and so there's really a big disconnect between people that are doing prevention, and usually it's a lot of NGOs, and then other groups that are doing treatment, and it's also scattered around, the government, non-government, and HMOs and private, and then there's long-term care, which is other NGOs, by the way. And so you have the data that is not flowing, but even when there is data, there's stigma, and so we're not sharing the data. Which leads to a lot of confusion, duplication of efforts, and loss of knowledge. And so these are also areas where tech can really help. So back to my framework, right? So on the top, the pathway, right, of primary prevention all the way to tertiary prevention. On the left, the columns of national, community, individual, and enablers. I'll take it one by one, but these are some areas that we've identified are really critical for accelerating trauma healing in Israel. One is this idea of national psychoeducation awareness. And again, to me, it has to be a national effort that really makes people, psychoeducation, by the way, is a tool that accelerates healing just by knowing that it's okay to be okay. I'll share a personal story of when I was working with Nova survivors. On October 14, one of them came, with 15, it was Sunday. He came and he said, I don't want PTSD, and that's why I came. I came with my friends because we don't want PTSD. And I'm like, well, you probably won't get PTSD because you came with your friend, because you're here, because you're looking for help, right? And 80% of people don't get PTSD even after a terrible, a terrible event like you've been through. And his entire body relaxed, right? His entire body, like the fear he was carrying, the stress he was carrying was from the fear of PTSD. So psychoeducation can really help with healing. There's peer-to-peer support with like things like Dugri and other technologies that are helping connect folks with one another. And of course, a lot of the people here will talk to us about how they're using self-care tools, which, I think Yair and Alex will touch on the self-care plus, as an add-on to the care you're getting from treatment, triage and screening tools that can help at the national level, community level, or individual level. So it doesn't have to be all diagnostic. People get really worried when we tell them AI is going to do diagnostics. Oh, really? AI can't do that. Only doctors can do that. And that's fine. We don't need to go there right away if we're not ready. But at least they could do triage, right? We can translate exact what the nurses do to do triage into a tool that helps them do that more effectively, even if the last decision making is still in the hands of those guys. And we need to unburden our mental health professionals, make sure they don't go into burnout, and we need to enable data sharing. And so, we can argue about where each of these logos should be for hours. But I want to say, like, the MindGuard, for example, is going to talk to us, Yair, about the community and individuals. And Kai will hear about how they're working also between community individuals and also helping with the connection with the physicians. XR Health, how they're helping with treatment and remote treatment, and it will also unburden physicians if it shows that it can be done remotely. And Ilios, who's doing a lot of work on unburdening physicians and generating data and insights. And so I'm very excited to have everybody here, and I hope this introduction was helpful to put everything in context. And I'm just putting this for, in case any of you want to reach out or have any questions, don't hesitate. And I also want to encourage you to use the chat function in Zoom, because we can look at your questions and then at the end, if we have time, take them or get back to you after this. All right. Yair, are you?
I am.
You are.
So thanks, Gila, for the intro. Thanks, Dan, for hosting, and then nice to see so like familiar faces. So before presenting what we do at the company, I would love to comment on one thing that Gila just said. Like as a part of what we're doing, we visited Sderot and like numerous times in the last few weeks, and the discussion about stigma, like teenagers are not willing to speak with psychologists. They're not willing to go to resilience centers. They're not willing to admit that there's a problem. That they're just like when you were speaking with them, and we talked with hundreds, they just say, I'm fine, like everything is okay. Which might be a good intro into what we're doing. So I'm not going to present a deck. I am going to show us a few slides. I would just love to share some details and to answer questions if you may have. So we are in the business of improving mental resilience. We currently focus on young women in Israel, and the focus is on their digital lives. Okay, so we today know, did anyone see the Sheryl Sandberg movie or at least hear about the Sheryl Sandberg movie? So today we know that like these types of imagery can cause something that is somewhat related to PTSD. And the question is, how do you treat that when it's not something that anyone wants to admit that's an issue? So what we're doing after meeting all of those young men and women is we adapted our technology that was developed way before October 7 into an Israeli version that is called MindGuard, that is analyzing digital behavior, okay, mostly phone usage, smartphone usage. Based on that, we know when we might need to intervene. Okay, so we know what's the right timing. Okay, for example, if I'm right now watching Sheryl Sandberg's movie, okay, that can cause a trigger. And then we provide personalized interventions. Okay, so we know when's the right timing to intervene, and based on that, and we provide the users with personalized interventions. Now, the challenge, we are going to launch in Sderot towards the end of the month. We're going to launch a program with 1,000 young women slightly after that. And we've seen that one of the challenges in doing so is that they don't want help. Okay, they don't want to admit that they need help, and they don't want to say that they have a problem. Okay, so what we're doing is we are providing them a mental health tool in a disguise of what they really care about, or at least what they are willing to admit that they care about, which is, I need to get over 90. Otherwise, I will not get accepted into what I want to do. I need to be creative because I'm studying architecture. Or I just want 1 hour of free time for myself. Okay, so we are helping them reach those goals by analyzing their digital behavior and how it prevents them from reaching their goals. And on the back end, we are helping them with mental health interventions. Now, I know it might sound vague, so maybe I will share a few slides to explain that. Okay, so we consider that as a real-time mental shield. We know that there are plenty of mental health apps out there. Again, our focus is on behavioral data in real time and on interventions in a personalized way. And this is how it looks. Okay, they enable us access to their phones. We did several experiments and we saw that they are happy to do that in most cases. And then once we understand that there's some level of stress, we pop up these types of notifications that again are personalized for each one. We did one pilot in Israel already. We saw that we had 3 times better engagement than the market average. We saw a bunch of studies, by the way, also in Boston. We saw that we can decrease negative emotions by 63%. And that we can increase performance. Okay, students said that the performance was increased by 40%. I'm skipping a few slides. We are working with top scientists globally. Okay, Mimi was the former Facebook psychiatrist. Gloria Mark is probably one of the leading scientists to understand human-computer interaction, and others. Nir and Michael are also from Boston. I will speak a little bit more about the model and about our current plans, and then Gil, I will give it back to you. So today there's an understanding that we can learn a lot by learning from passive data, such as screen time, lock and lock events, and browser history, which is what we're using now, to learn about human behavior. Okay, so that's like sleep, phone use, etc. And from that to learn about stress. We believe that one of the reasons that mental health apps, generally speaking, I know it's a blunt Israeli thing to say, don't work, because they are not personalized enough, and they don't know how to provide the right interventions at the right time. And so that's hopefully what we will provide 1,000 young Israeli women by the end of the month. I think that we will stop here. So Gila, back to you.
Thank you so much, Yair. Any questions for Yair from the audience? You could put them on the chat or raise your hand. Yair, you are crystal clear. This is so obvious for everyone. So thank you so much. And I think our next speaker is Alex.
Hey, Dan, can I make a comment? Or Gila this Windsor?
For sure.
Just a couple of thoughts. The mental health is from an engineering, I'm not a psychiatrist, but I've been involved with a lot of organizations globally and locally, and there are environmental factors and individual factors. And as individuals, just as people, when the environment is beginning to change, it creates stressors for people, and it could create unevenness relative to what I think is development of a proper conscience. So what happens, especially in younger children, um, they need relative to development and brain and social and emotional and psychological development when they grow up as at home, we provide a safe environment for them to grow and interact. And a society begins to change. I think those factors are beginning to change as well. And then um, from a different standpoint, there's uh, Dan knows. I think there's also a spiritual issue, and that's really it. Okay.
Yeah.
Just trying to help. Okay. Because what
No, no,
happens is we can't. None of us live in community by ourselves. That's the outside the definition of a community. And so people are fundamentally social beings. So what we do is we get our individual identities um, uh, spiritually, and each of us are uniquely different. We're not the same. But then there are communities and societies that begin to group people in different things. And when people choose to pit certain societies or communities against each other, it creates conflict within that structure. And then that spills over and create trauma to people, not only at an individual level, but also at a community level. So that's why there are boundaries, right? And they're given to us, as you guys know, right? With the commandments, right? So that's all I really have to say. Okay, thanks.
thank you, Windsor. Thank you.
God bless you.
Yes, thank you. And there's one question from Milton on the chat. Yeah, I think it's for you, Yair, more about how do you actually do that triage according to severity and or potential diagnosis?
In the question, Milton mentions the stepped care method. So we definitely consider ourselves like step one. Okay, like others like will speak about their products. Like if I may, Alex, like I think Alex is like further ahead. Also, like, but we will speak about his product. Like we definitely consider ourselves as like as a simple treatment that can diagnose and help with simple, relatively simple issues. When I talked about something that is similar to PTSD, so that's like on the very light side of that, in order to prevent and help on a mass scale. I think that Alex is after. So we might be able to speak about like the next phases of stepped care and the more complicated treatment. Once we see repetitive signals of stress, by the way, that's one of the things that Resilience Centers in Israel asked us to do. We ask the user if they are willing to speak with someone. Okay, that's one of their incentives. Like they know teenagers are not reaching out to us, so just send them to us once they express some interest. And I hope that kind of answered the question.
So thanks, Yair. Alex, you wanna start a? Yeah, amazing. And you're wearing the right T-shirt. So go, Kai.
Thank you. We're participating in an Intel event, so I even have a name tag. So
Wow.
I hope you can hear me okay. I just entered one of the rooms, and I apologize if there is noise here. Kai is using generative AI to provide human clinicians with tools that can enable them to support more people in a more efficient way. We started 4 years ago. We're a US-based startup. That's our main market. Obviously, recently we're working on a Hebrew version of Kai. We have a team that combines clinical backgrounds. I majored in clinical psychology myself, practiced for a few years. Kai raised over $6 million over the years with good VCs. We're part of Google for Startups. And at the core, what we've been building for the last 4 years is a personal companion, personal coach that works on messaging. Kai, just a contact on the main messaging apps, also on iOS and Android, but people can chat with Kai very, very easily on their phone. Kai is a proactive agent. Kai will do the triaging, will do check-ins, will do a lot of the psychoeducation, will share different tools and interventions, and it will build a personal program and plan for every single user. And it works in a similar way on any messaging platform. So I can have a conversation with Kai wherever I feel comfortable at my own time. It's asynchronic. Kai will be a kind and a patient companion. It's now a good time. And this builds the memory and the ongoing conversation. The exciting thing is that we scaled Kai to a very large amount of users, more than 100,000 monthly active users. As I mentioned, we're part of Google for Startups, the health program. We published 2 research papers. We built a very large community focusing mostly on Gen Zers, young people engaging with Kai. And this was a very hard work to actually show that engaging with the conversation AI over time can improve well-being. We see clear improvement after 1 month, and then an ongoing improvement on standardized assessments, which is key. And it allowed us to build a very large data set of conversations and keep improving and training the AI. And people share with Kai, get very deeply. Gila mentioned the stigma, sometimes shame, sometimes worry about being judged. People find it much easier sometimes to just share when they know it's artificial intelligence, and they share very, very deeply, not only about anxiety or trauma, but about any other subjects. And currently, in the last year, we're focusing on using the platform to enable clinicians. So we built a full backend for clinics and psychologists and psychiatrists. This allows them to manage the wait list, the lack of enough clinicians to support more people by using Kai's platform. The way they do that is that they use the platform to create a digital intake to set an initial baseline, and then they can build a personal plan for every single person. So Yair's program and Nathaniel's program would be very, very different. People can work with Kai, and Kai generates the data for the clinician so that they can track the progress and adjust the program. And this is basically how the platform works. The clinician builds the program, the client works with Kai, and the clinician gets the data. The clinic gets the data. Who needs more attention? Who's making progress? What plans needs to be adjusted? And the exciting thing is we have experience implementing Kai when the war in the Ukraine started in Russian and Ukrainian. So that was very, very significant to provide support in real time when there weren't enough clinicians on the ground. We recently signed a very significant agreement with the joint organization to translate Kai into Hebrew. Basically, I'm working with a Hebrew version of Kai that will do the same, that will do checking, that would support me daily. And this allows the clinician to adjust the program. And we're also working with clinics in the US, specific clinics, to enable their clinicians to work with the platform. And that's basically what we do, and I'm sure that there are many questions that I would love to answer. Maybe I'll add one last comment before passing it on. So a key takeaway working on Kai for this time is that the technology, the AI, cannot replace the human touch, cannot replace the clinician, but we can help with clinician burnout, with allowing clinicians to do more supervision work, and also allowing a non-clinical human team to provide ongoing support by leveraging the technology. But the human touch is key in any case, definitely when dealing with trauma.
Great. Alex, we have 2 questions that are pretty similar, and I think where they're trying to get to, which is how do you do triage, detect a mental health emergency or a potential, like basically when do you raise a flag? I would guess.
The technology is very, very good in identifying emotions, change in sentiment, keywords, definitely violence, suicidal thoughts. We have a 24/7 human team that would triage the technology and evaluate if there is risk. And if there is risk, we escalate. We say, Gila, this is very significant. You need to speak with someone right now. Here's the phone number. And the important thing is that because Kai so easy to use, frictionless, you can always ping it at 3 a.m. and say that you need attention. It can really help with prevention and help build resilience and definitely identify crisis before something goes terribly wrong. That's very important. Thank you for asking.
So there's a question by Milton, which is if it's not a crisis but a diagnosis, do you guys do any diagnosis or I don't? Yeah, go for it.
Yes, so part of the intake process, the client will fill in a couple of assessments. We do assess anxiety, depression, and this is used both to build the personal program, but also for basic screening. So if the level of distress is acute, Kai won't deal with that. Kai would say this has to go to a physical treatment or a psychiatric assistance. So Kai would be maybe step 2 or 3, but we wouldn't replace a hospital or a psychiatric medication treatment. We evaluate in the intake and then at least once every few weeks.
You reevaluate. Perfect.
Yes, exactly.
Very good. So in the interest of time, Alex, I'm going to say thank you. And I think we have Anat on the line to speak about XR Health. Hi, Anat, you're Zoom user for us. So hi, Zoom user. And we and I go for it. I know you're in the conference as well. It's
Yes, my name is Dr. Anat Kaufman. I'm the head of the clinical department of XR Health in Israel. And we are a company also stayed in the States, actually, in Boston. We are a company who work with medical treatment with using VR. And we have several unique platforms who are really amazing how we can progress and help people using the VR therapy. So our goal is actually to make the therapist a super therapist. It's like give him the power, the superpower that he will be able to work in many different levels during the same session of therapy. So we have a few ways how we can work. We call them spaces. So our platform is divided in several spaces. The first spaces, as you can see right now, it's a spaces of mindfulness and guided imagination, and it helps you to relax and to calm. And this is a space that everybody can use it by their own. We have like quiet rooms, quiet spaces that we create in Israel and worldwide. For example, we have quiet rooms in hospitals, in hotels for the evacuation people from the north and south. We have in the police department in Israel in 90 stations. And the quiet room, it's a nice place that you have a nice sofa. It's really comfortable to get in. It's really a quiet environment that you are able to use the headset. And just by choosing one of these environments, you can escape from the reality and calm yourself in a different way. You can choose to swim with dolphins. You can play with Luna, which is a freezing environment to activate the parasympathetic way. You can work with the relaxate, as you can see right now, who's working with the bilateral and coordination of the breathing. You can do fitness, which is really empowered just to take all the aggressive, or you can do work in groups. Another way that we are able to work, we have the mental health platform. We are using always the Emilia platform. It was the Spanish Emilia. Now we merge it into XR Health. And this is an amazing way to make us super therapists, actually, because in this way we are able to label a few techniques in psychology in the same time. For example, you're able to do exposed therapy from one side, and from the other side, you can add a level of biofeedback, a level of text messages in CBT or ACT or your discipline in psychology. You can also add the EMDR, stand by himself, the EMDR, or you can use it together, the EMDR with the exposed therapy and the other platforms. And after that, we have the reports that you are able to see how much of the time the patient is trying to avoid of watching the places that it's triggered in, and how many times he's able to progress and is able to work with himself much more. The things in Israel since October 7 that we're working in many places. We are working with the army, we are working with the hospitals, almost all the hospitals in Israel, with the resilience centers. That we have a huge resilience center in Ofakim, and we're going to soon work with United Hatzalah, which is a health organization, big organization in Israel, and many other places. The work is one-on-one, doing the intake and building the program, the therapeutic program. And after that, you're going to meet the patient once a week, and by time twice a month and more. And every day the patient is taking the headset home and is able to work with the headset by the program that the therapist is writing for him. So for example, he will have a protocol every day. We're going to open the headset, it will connect by his code, and then is able to work by the specific program that he has. And the therapist is able to take the data and to see how we progress and to do fine tuning, and then to sketch a meeting again and to change it. So we are able to, we try to able to reduce the gap that we have less therapists and many patients in this terrible time. So thank you.
Very good. Nofia, I think you had a question that was answered by Anat in the end, but you know, not everybody gets EMDR. That was an example, right? It could be EMDR, it could be prolonged exposure, it could be anything that the doctor or the therapist, right, decides is suitable for that patient, and it gets adapted according to the need of that person. And so I'm going to open the floor for Dror.
Hello, everyone. My name is Dror Zaide. I'm one of the co-founders and general manager at Elios Health. Elios is the goddess of compassion in the Greek mythology. And basically, we help behavioral health providers save time on documentation and provide better care. I'll give you a short presentation about what we've done to date, a quick demo and testimonial video. I'll try to push everything in 10 minutes. Let's go. So let me know if you can see my screen here. Perfect. So we go by more care, less ops, basically more time to focus on care when you have less operations and less obstacles. We have the largest data set in the world when it comes to analyze behavioral health conversations. So Elios sits in the background of therapy sessions and then analyzes the session, and then brings suggestions embedded into the EHR for the providers to include in their notes. We can also help them reduce documentation time when we don't have the conversation in place, and I'm going to demonstrate that in a couple of seconds. We have more than 80 customers to date, raised some capital, and basically have been growing in the last 4 years. We have a lot of clinicians on our team, and they help us build the models and kind of like help the computer understand how to understand what are the most clinical relevant moments in a conversation. There is no human in the loop on our models that are in production, but when we develop a new model, there are humans that help design that. And once the computer meets a human level, that's when we release something into the market. And this is just a map of all of our customers in the United States. We've been rapidly growing, and it's just amazing to see the impact that we're able to bring. I'm going to show you a quick testimonial video. This one is about improving care while you introduce AI that helps the provider, be more present and provide better care. So I hope you can hear it.
I just think I'm more present, period. My attention isn't split. I can just focus on the client.
If you have a workforce spending their time focusing on the documentation piece, then that's less time that they're able to give to the client that's in front of them. I think that we'll have better outcomes as an agency whenever our clinicians are able to focus on the individual in front of them rather than focusing on what is this going to look like in the body of a note.
I think it's great because it does help save time. It helps you to be very present, like in that moment with your client. It's definitely helped me to be focused and attentive to the client versus trying to keep track of what I'm doing in my head and on paper.
When you're first training, you have a lot of opportunities for feedback. I mean, someone's in the room with you, or there are two-way mirrors, or all kinds of teaching devices. And then that stops. And I think in some way, we come to a bit of a halt in terms of our development. Elios is a feedback system. So they have a list of the keywords that I use during the session. And then they also have a list of the keywords the client used. If they're very different, I need to stop and think about that. Maybe my attunement isn't what I thought it was.
It's helped me to be a better clinician, I feel. I myself don't recognize what I've done at times during sessions. Let's say I haven't done too many open-ended questions or closed-ended questions, or the amount of time that I speak. That section, letting me know what are the skills I am providing for therapy, has really benefited me in trying to become a better therapist.
Therapists used emotional regulation technique, or therapists used whatever. If I were to equate it to a therapeutic model, I am doing those things. My mind just doesn't think about it as I'm doing it. My goal in treatment with people is to build relationships. They are going to get the most benefit out of me having a relationship with them and being heard and having a safe space to kind of process this stuff.
Elios has been a lifesaver. I absolutely love the product. I love the ease of use. I love that it has freed me up to be fully present with the client, which is what brought me to this field to begin with.
So I think that it's better to hear it from the people that use it, because as a founder, I'm always biased, and also I'm the person responsible for sales, so I'm always biased even more. But here's a short description of the problem, and then I'm going to show you one of our products. At the end of the day, we don't have enough providers, and in behavioral health, I think there still will be scenarios where we have people that will need to treat people. I also think that there will be scenarios where we can have some support that will be automatic or artificial to support people, because the demand is just growing and there's not going to be a possibility to serve everyone with a human all time. So I don't think that computers are going to replace all the therapists, but I do think that computers are going to provide some level of support when there aren't people awake or things like that. And therapists who are assisted by artificial intelligence are going to replace therapists that are not assisted by artificial intelligence. And I'm not a provider by training, but what I'm going to show you is how we can save time for one staff member. So this is one of our features as part of our Scribe product. But let's say that I'm going to jot a quick note here, and I'm going to use Yair here as my client. I'm going to jot in talked with Yair. Whoa, that's in Hebrew. Talked with Yair and provided breathing exercise. Is actually fine that I'll do it with spelling mistakes, so forgive me for that. And then I'm going to say depression seemed elevated, which is this is a mark that staff members use in their EHR for like increasing depression. PHQ-9 scores increased to 24. Yair seems sad and
Listening, so be careful.
sorry.
He's listening, so be careful.
Oh, don't worry. It's hypocritical.
Not too far from the truth as an entrepreneur.
That's good. Stressors at work from increased investors, whatever. And Yair seems better than last time. Last time provided CBT guidance, whatever. I'm not a provider. Then I can choose some CBT restructuring or a couple of more things. That his speech was coherent and other things. Great. And now I'm going to ask Elios to help me build the note. And in a couple of seconds, what you'll see is that basically the computer has built a note that is going to be adjusted to the clinical guidelines of the organization that I work in. Now, you saw how much time it took me to put in 6 bullet points in place. I know that it was a lot of patience required from you, but if you will read these things, you will see that it's pretty damn good and it's linked to what I wrote. All right, like here is my PHQ-9, mentioned experienced stresses at work, especially related to increased investors. Despite these difficulties, here seems better during the previous session, yada, 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 yada. The idea is that today, providers, they don't do their notes on time, and it takes them 10 to 15 minutes to do a note like that, and they procrastinate and delay the time. They kind of like fear that moment in their day that they're about to do their notes, not to mention that they don't remember what they discussed with Yair, and they've been talking to a lot of people during that day. So we make this whole thing be much easier. You don't need to write everything down to be compliant with everything what the payers are looking for. You can sit down, jot a couple of bullet points, we'll take care of your note. And we have other products that also take care of like what you've said in the conversation. They bring it into there for you to as a suggestion to put in the note. But I just wanted to show you kind of like a quick demo of how you can take artificial intelligence and bring it into the field in a way that helps the human do their work and not replace them. So hope this was interesting, and I'll be happy to answer questions.
All right, so Dror was our last speaker. Thank you so much.
Just
Any
one quick
questions?
question. Just to Dror.
Yes, who did?
So it's just typing in the notes, or can you speak the notes and record them and do voice recognition? And
this is one of our products. This is how Scribe helps you do your notes when you didn't capture the conversation. We have 3 more products. One of them within Scribe, you can capture the entire conversation and it will distill suggestions from the conversation to you. So imagine you and I were speaking, and then at the end of that, after that, I will get, as the therapist, a couple of suggestions that will say, you know, for my next steps part of the note, here are the next steps that you've mentioned, you know, to Oded on the conversation. So that's one option. We have another product that is for case managers that go into the field, people that go and provide care inside houses in the field. So they're not sitting in a clinic, and they're kind of like what you've seen with the bullet points. They can do it from their phone, and they can also dictate from their phone the bullet points. So if someone doesn't want to type, we have some of them are doing it like while driving. So they put the phone, they click on dictate, and then they dictate their notes, and then they click on generate note, and then they send it to their EHR for final review later, but then they don't need to remember everything. So when they come back to the clinic, everything is done for them, and then they're good to go. So there are different types of behavioral health providers, and you need to adjust for each one of their workflows. So yes, there are options like that. It depends with
Thank you.
Amazing. We're right on time. If anyone has a final questions, let us know. Raise your hand or forever remain silent. All of us are happy to get questions. Dan, any closing words from you?
Well, I would like to thank the panelists. I would like to thank Gila for moderating. And of course, I would like to thank the audience for coming and listening to us. And with that, wish you a great weekend. And as they say in Hebrew, Bsorot Tovot.
For that, Dan, and thank you for
Amen.
organizing and bringing us all
everybody.
together. Bye,
Toda.
bye-bye.
Thank you.
תודה
תודה
רבה.
רבה, דן.
Okay.